everyone, my name is Maddineedi, and today we're going to be unmasking the silent cause of secondhand smoking, a global health crisis. So before we begin, I want you all to close your eyes for a moment and imagine yourself in a crowded cafe or in a bustling city street. The aroma of freshly brewed coffee and the sights and sounds of urban life surround you. But amidst all the hustle and bustle, an invisible danger passes by unnoticed: secondhand smoke. So a little bit about me. I'm going to be your presenter for the next 7 minutes. And again, my name is Sreenidhi, and I'm a rising sophomore at Johns Hopkins High School in Union City, California. Talking about some of my personal pursuits and extracurricular activities, I'm a cancer researcher. In fact, I recently collaborated with some Harvard University faculty members on a meta-analysis of the enter complexes with further focus placed on its implications in lung cancer. I'm also a mental health advocate and lead presenter at the local library forum discussing public health concerns, as well as an active hospital volunteer and student and volunteer photographer. So a brief overview of today's discussion. We're going to start off talking about the background of secondhand smoke and jump right into some of its health impacts and consequences. From there, we'll move on to this really beautifully titled part of my presentation, From Exposure to Economies. Then we're going to conclude talking about some of the best practices in the way forward, and then finally with the credits. So talking about this global harm of secondhand smoke, it's really a pressing global issue that knows no borders. In fact, the World Health Organization, the WHO, reports nearly 880,000 deaths each year due to secondhand smoke exposure among non-smokers. In fact, in 2012, nearly 64% of these deaths were of women, making this a gendered health concern. In fact, this number of deaths is equivalent to almost an entire city vanishing from the face of the earth every 12 months. And I think Figure 1 does a really good job of showing how there's not even a single country that's invincible to the harm of secondhand smoke. And this is supported by a variety of different statistics. The CDC, in fact, approximates nearly 58 million Americans are exposed to this deadly health hazard in various settings, including our own houses, workplaces, and public areas. The CDC, in fact, also reports that since 1964, nearly 2.5 million non-smokers have died due to some of the health complications and problems that are caused by secondhand smoke exposure. And unfortunately, a similar census is reflected by almost every country, be it in the Middle East or the Eastern Mediterranean region, where among students aged 13 to 15, nearly 38% are exposed to secondhand smoke at home. In fact, in many countries of this region, only a quarter of houses are actually smoke-free, leaving a large portion of the population vulnerable to its harmful effects. Pictured here is a very popular Middle Eastern smoking apparatus, the hookah, which is found in many households and public spaces. And on that note, we can start talking about some of the toxins that is contained in the smoke released from these tobacco products. It contains over 7,000 irritants and toxins, as well as well over 70 carcinogens, or cancer-causing chemicals. In fact, regular exposure to secondhand smoke can significantly increase the chance of developing some serious health conditions, such as lung cancer and coronary heart disease. With lung cancer, we see individuals having anywhere from a 20 to 30% higher risk of developing it, and with coronary heart disease, anywhere from a 25 to 30% higher risk. Talking about children, children do have smaller lungs and less developed immune systems, and are thus particularly vulnerable to the dangers of secondhand smoking. In fact, the World Health Organization reveals that nearly half of all children worldwide have been exposed to secondhand smoke. And it's also responsible for nearly 65,000 child deaths and 430 cases of sudden infant death syndrome reported annually. This figure shows how even in the US alone, over 42% of states do not have comprehensive smoke-free laws. So just think of the number of children who are growing up being exposed to toxic secondhand smoke, perhaps on a daily basis. And moving away from the topic of mortality for a minute, we can start talking about DALYs. So DALY is basically stand for disability-adjusted life years, which offer a measure of the quality of life of an individual who is disabled, in this case, due to secondhand smoke exposure. And in fact, a global burden of disease study conducted by the IHME reports nearly 35 million DALYs are lost annually due to secondhand smoke exposure. Figure 3 does a really nice job of breaking it down into various causes, and we see nearly 15% of these DALYs lost are due to lung cancer worldwide. We'll return again to the topic of DALYs when we talk about economic burden. But switching over to exposure, we see this really disproportionate impact, with disadvantaged populations bearing the brunt of secondhand smoke's impact, and that perpetuates health inequities. Talking about individuals who live in poverty or in areas with limited smoke-free environments, such as multi-unit buildings, we also see them facing higher levels of secondhand smoke exposure because, remember, secondhand smoke can easily infiltrate through doorways, hallways, ventilation systems, even plumbing and through the walls. And that further increases the vulnerability of these communities. So remember, having these comprehensive smoke-free policies is really vital for promoting health equity. Talking about exposure in these public places, we see it up to 5 times higher in places such as bars, restaurants, and casinos. And that poses a significant health risk to the food service workforce. In fact, nearly 24% of them actually fall in the same age group as most of us attending this conference right now. Interestingly, though, economic studies do show positive results in these smoke-free ordinances for restaurants, as well as the sales tax data depicted here in Figure 6, showing that these smoke-free policies can actually lead to an increase in business for many bars and restaurants. So talking again about this economic burden of secondhand smoking, we see significant healthcare costs and productivity losses on a global scale. In fact, in 2018, smoking and secondhand smoke exposure cost the US nearly $240 billion in healthcare spending alone. And in the most recent year, in 2022, it costs well over $10 billion in lost productivity because it includes absenteeism, reduced work performance, as well as having to deal with the increased healthcare expenses. So remember, we need these comprehensive measures, not just to reduce secondhand smoke exposure and to protect public health, but also to alleviate the financial burden that's placed on these healthcare systems and economies worldwide. So it begs the question of, well, what are the best next steps? So what's the way forward? Remember, there is no safe level of secondhand smoke exposure. Everyone has the right to breathe clean air, so we need these comprehensive smoke-free policies to really ensure such an environment. We need stricter laws and regulation to counter the tobacco industry's advertising practices and false campaigns. We need to increase awareness about the hazards of secondhand smoke to protect individuals, including fetuses, children, family members, and for all of us from its harmful effects. We also need to encourage collaboration among international organizations such as the Cochrane Collaboration, which is essential for conducting evidence-based research and for providing customized recommendations on effective tobacco control interventions and policies. So to everyone who stuck around this long, thank you so much for listening. Again, thank you so much to the Johns Hopkins University GHLC team for accepting me to this conference and for giving me the opportunity to present my work. Thank you so much to my parents for continuing to support me in everything I choose to pursue. And of course, this presentation would not have been possible without the work of the countless researchers who are conducting various surveys and studies, the physicians who treat individuals who are facing complications from secondhand smoke, as well as the global health professionals who are working to increase awareness of secondhand smoking. So it's to all these individuals that I give a very, very sincere thank you. Here are some of my references if any of you guys are interested in checking out these sources. And again, thank you so much for listening. If you guys have any questions, comments, or concerns, feel free to reach out to me. Here's my personal email address listed below. And again, this is Sreenidhi, and thank you for joining me to unmask the silent perils of secondhand smoking. Bye, everyone.